Let's talk about normal labor and labor. So, what is this? Labor is a series of events that take place in genital organs to expel out the products of conception through vagina. Now, in normal labor, it happens at term. It has to be spontaneous. It comes with vertex presentation, no delay, no complication, natural termination of pregnancy. Now, what we use to monitor labor? We use clinical signs, CTG, and most important is partograph. Let's talk about all the stages of labor. So, we have first true labor pain, true labor pain to full dilation of cervix, then the main event, that is baby delivered. Next, the placenta delivered, and after that we have around 1 to 2 hours of observation period. Observation period, that is golden hour. Okay, so these are the events and these are the stages. This is the first, second, third, and fourth stage of labor. Now, every stage comes with little bit of science and important stuff. Now it has, let's talk about the first stage. So it has two parts. One is latent phase and the other one is active phase. The latent phase can vary for hours to days. Active phase is for 4 to 6 hours for primigravida female. Okay, here the first things that happen in first stage are mucus plug passes out. It is called as show. Cervix dilation and effacement happens. So we have two pictures. One is before, this is this is 0% effacement of effacement. This is uterus. It is thick, so it is 0%. Kindly, over time it gets dilated and efface out. So in complete dilation, it looks like this. It thins out, it gets shortened, and it look like this. Okay, complete dilation. Here on examination, what we can see the membranes filled during contraction, rupture of membrane can show liquor escape. In the first stage, the most important part is contraction. In latent phase, we have slow, irregular contraction, and it effaces up to 4 to 6 centimeter dilation. In active, we have regular, strong contraction and 4 to 10 centimeter dilated. Here each contraction happens in every 3 to 4 minutes for 60 to 90 seconds. Okay, next, here as a management, pain management can be done. For pain analgesics, and close monitoring, continuous assessment is done. Now let's talk about the second stage, that happens for 1 to 2 hours. It happens for, here contractions are more stronger contractions in 3 to 4, 2 to 3 minutes, 2 to 3 in every 2 to 3 minutes for 60 to 90 seconds. More stronger, more powerful. Mother shows maternal effort is seen. Maternal effort, voluntary effort is seen. It is called as bearing down. Membranes got ruptured. So liquor comes out of vagina. Now here we have to assess as well. Examination is done. For examination, we have two things, that is, in examination of the situation, we have the fifth formula, fifth finger rule. So let's see. Examination will be written here. So we have the head, just make a head, and now we have fifth finger rule. So if this is the pelvis, then this is 5, completely above brim. Next we have 0 at the level of eyes and nose. Head not palpable. Next 2, 3, 4, there will be no line like this. This is 1 above the ear. This is 2, this is 3, and this is 4. Here sinciput felt, occiput is not. And next sinciput felt, occiput also felt. The next is sinciput is high and occiput is easily felt. And the last one is sinciput is high and occiput is easily felt. Same. When it is two 5 means head engaged. When it is 0/5, it means head is in pelvis. Okay, his fifth finger rule. The other one is station. We have our pelvis bone. Now just make a little bit of sacral as well. Sacrum. Let's make a little bit of chamdi. will be like this. Now, what is this? This is the level 0 at the ischial spine. The level of ischial spine. This is 0 station. We have at ischial spine. It means just engaged. Head is just engaged. On parvaginal examination, this is seen. Above this, everything is negative. So 0 -1, 0 -2, 0 -3. Below everything is positive. Zero plus 1, 0 plus 2, plus 3. Let's talk about what happens in this stage. In this stage, the baby bonds. So let's talk about that part. We have the delivery. Progress is seen as crowning of head, perineal bulging is done, and apiostomy can be performed, may need to perform. In this time, stools also come out. Stool comes out, baby comes out, then also liquor comes out. Here during delivery we have normal delivery, or assisted delivery, ASD delivery. Okay, let's talk about the main, the third stage from 3 minutes to 30 minutes. In this stage, what happens? The placenta comes out. For that, blood comes from vagina. The signs of placental separation: blood from vagina, along with contraction and lengthening of umbilical cord. These are the signs of placental separation. After that, placental expulsion happens. Then we have to inspection is done for any retained tissue. During this time, prevent some management is done, that is ensure prevent excess bleeding by oxytocin. Uterine massage is done. Uterine massage for to help contract, monitor, and episiotomy repair. Before separation, the uterus is discoid in shape. Now it's globular. Before separation, before and after placenta separation. Before the uterus was discoid, non-ballotable. Now it becomes globular, ballotable. And umbilical cord length was fixed, static. Here happens lengthening. Cord. Okay. Now last phase, that is the golden hour phase, that is the fourth. After this, all of this happening for 1 to 2 hours, observation is done, vitals are checked, blood pressure, pulse, BP, uterine tone is checked, uterine tone monitored, uterus should be firm and contracted. No excess bleeding. Monitor the lochia rubra, lochia serosa, and lochia alba. Last one. Rubra, serosa, then alba. Next, bonding and skin to skin contact, breastfeed, in this stage. For management of pain, we have analgesics, NSAIDs, analgesic, NSAID, opioid, everything, and monitor for excess bleeding. That's it. That's the entire labor stages. Let's draw one last diagram, that is for partograph. If I have this. This is time, sorry, this is time, and this is centimeters. Cervical dilation, cervix dilation. So 10 centimeter, everything statics. So my target is 10 centimeter. It is 0. So initially the latent phase, let's talk about the latent phase. Initially around 2 centimeter or below that, I have latent phase. It comes. Then I enter in the active phase. It is acceleration. Okay. And then phase of with maximum slope and deceleration. Okay, let's make it 10 centimeter. And it remains there. So this is the latent phase. Then I have the active phase to this part. This is the active part, and this entire thing is first stage. So if it is first stage, so it has time around 14 hours. Here in active phase I have 3 stages. One is acceleration with deceleration and slope. There is a straight slope. Okay. So it is acceleration, this deceleration, and the rest is just slope. Next is second stage. After 14 hours, it only takes few minutes. Bolo.